Hello, I am Dr. Corey Bauer, an optometrist with Wolf Eye Clinic in Iowa, practicing comprehensive optometry with an emphasis on specialty contact lenses and cornea. For the past year, I've had the opportunity to work with the OculoCAM system. This section will be directed to specific examples within a typical practice setting. All of the following images were acquired during normal clinic hours and demonstrate applications of the OculoCAM system obtained during the hustle and bustle of a busy clinic schedule. For contact lens practitioners, OculoCAM provides access to fitting methodology once limited to large practices and teaching institutions by allowing real-time video of fluorescein patterns for fitting and consultation to be made at a nominal cost. Once you are familiar with the system, videos take only minutes to acquire and will save you valuable chair time and enhance the fitting process. Let us begin by examining a complex contact lens fit that many practitioners might choose to avoid. Before positioning the camera lens near the ocular, add 1.8 to 2 times optical zoom to fill the screen. The magnification may be increased during filming by adjusting the slit lamp magnification or using digital zoom. As demonstrated by the topography, the patient has a moderately keratoconic cornea on the left eye. A specialty bicurve keratoconic design trial lens was selected based on the keratometry readings and topography according to the trial lens fitting guide suggestions. The lens parameters were a 50 diopter base curve lens with a 1 mm flatter secondary curve. The lens demonstrates adequate centration, but there is excessive central pooling, bubbles, and peripheral bearing. Over-refraction provided 20/40 best corrected acuity. At this point in the fit, practitioners fortunate to have a large keratoconus fitting set would simply continue by selecting another lens. Others would make clinical notes on the fit characteristics and order another trial lens, often with assistance via telephone from a consultant from the contact lens manufacturer. With OculoCAM, it is practical to email a still photo or short video clip to the consultant to assure the next lens received will be close to ideal. Here, the next lens selected was 1.5 diopters flatter centrally with only a 0.5 mm flattening of the secondary curve. There is now slight apical touch, and the peripheral lens now allows adequate tear exchange. Over-refraction now resulted in 20/20 best corrected acuity. The final lens was ordered to be a 1/2 diopter steeper and will be dispensed at the next appointment following insertion and removal training. The entire encounter, including video, was achieved in less than 20 minutes. At the end of the day, the video was reviewed in detail, including slow motion, and the final lens ordered. If there had been any additional concerns, the still photo or video and topography would have been emailed to the contact lens consultant for further review. It is also beneficial to document each specialty RGP patient with a simple still photo for year-to-year comparison. If problems arise, it is simple to compare present-day fit to prior photographs. While saving and organizing video clips would be cumbersome, still photographs are easily saved in most EMR systems or printed for the hard record. Here is a photograph of a corneal graft with an extreme amount of irregular astigmatism requiring a large diameter specialty lens. No changes were made to the lens as the patient had no complaints and the graft was healthy. At the next appointment in 6 to 12 months, the photograph will be available for precise comparison. A combination of cobalt blue filter and handheld yellow filter were used to illuminate the fluorescein patterns in the prior still photos and videos. Note the placement of the yellow filter between the patient and the objective lens of the slit lamp. The photograph demonstrates the contrast the yellow filter creates with the fluorescein pattern and the epithelial staining. The illumination provided by the yellow filter is superior in both tear layer and epithelial compromise as compared to cobalt blue alone. This standard RGP fit further demonstrates the contrast between the two filters. Also, note how the video easily demonstrates the lens movement, location, wetting characteristics, as well as the dye pattern. The first eye is fit on mid-K and shows a close to alignment fit, perhaps slightly flat. There is some mild edge lift and minor surface wetting irregularities and deposits. The next lens was fit 2 diopters steeper than K and exhibits the expected central bubble and excessive mid-peripheral bearing. Both examples highlight the superiority of the yellow filter for assessment and the detail achievable with this system. While I have found the OculoCAM system most beneficial for complicated cases, there are several other useful applications in standard lens fittings and in patient education as well. Photographs of contact lens deposits serve as excellent reinforcement for cleaning and replacement programs. In the first slide, the patient was wearing her lenses overnight while using antibiotic ointment for blepharitis treatment. These were actually crystalline precipitates from the ointment. The next photograph was used to convince the patient it was time to replace his 4-year-old lens. This video clip was taken to reveal the cause of ongoing discomfort and the need to replace this daily wear lens. Similar soft lens videos are helpful in troublesome soft toric cases where close observation of toric rotation with each blink is required. Note the position of the 3 toric markings inferiorly on this video clip. I have found the slow motion review features of the cameras are particularly useful with soft toric fits. In addition to contact lens uses, the OculoCAM has demonstrated versatility in other aspects of practice, and I'll touch on a few I consider worthwhile. Patient education has been one of the most common uses of the system, both with pathology and contact lenses. This still photograph demonstrated the source of ongoing discomfort from recurrent erosions. It was also useful in monitoring progress as this patient required nearly 2 months of bandaged lenses due to large erosions occurring almost weekly. The final video clip was created for a patient with complaints of intermittent blurred vision who doubted the diagnosis of dry eye as the source of her frustration. The video made further explanation unnecessary, assured compliance, and made it simple to gauge response to treatment. In today's environment, clinicians must be wary of cases that may have a higher risk of litigation, and OculoCAM may be helpful to protect both the doctor and the patient. All cases of trauma, personal injury, and workers' compensation are suited to photo documentation. Foreign bodies such as this can be easily photographed before removal to document necessity. The final series was used as documentation of an alkali burn from anhydrous ammonia in a workman's compensation situation. There are undoubtedly other potential applications and adaptations of this versatile system throughout the ophthalmic field. It is hoped that by sharing these experiences, you've gained some insight into the potential for OculoCAM to enhance your practice and your quality of care.